But not only does homocysteine affect your arteries, it affects your brain. It literally causes the brain to atrophy, and it causes the brain to calcify arteries in the brain, which can lead to vascular dementia. There's different forms of dementia. Hey, Dr. Colbert here, and we are on our 7th key number that you need to know, and it's your homocysteine level. You say, why is homocysteine so important? This is a toxic amino acid that's a bad actor that you need to lower, because let me just read you this one study, interventional trials in elderly with memory loss, cognitive impairment, show that lowering your homocysteine level with just simple B vitamins will markedly slow the regional brain atrophy. In other words, it slows your brain shrinkage. If you have high homocysteine levels, the brain will atrophy. If you can suppress that homocysteine with B vitamins, it slows brain atrophy. But not only that, it also slows cognitive decline.
My goodness.
This is amazing. So this is one of the major things we need to do is lower homocysteine levels. Normal levels is 5 to 15 is still too high. Many experts are saying we need to lower it below 10 micromolar per liter. So remember the number 10. And your doctors will say, oh, it's 15 or it's 20. Some labs have 20 as normal. If your number is over 10, you are slowly atrophying your brain, especially if you're elderly, and you're destroying neurons in your brain.
What do you call elderly?
Well, before you do, welcome to Dr. Colbert's broadcast. We are excited. I am here with my dad, Dr. Don Colbert, and my mom, Mary. And today we are going to be talking about number 7, which is homocysteine levels. Do you know that number? That's the question. By the end, we hope that you set an appointment so that you will know the number. Dad, tell me about homocysteine. We know the study now.
Okay, so before he goes into the study, when you say you need to know it, the only way you can find this out is what? Through
A blood test.
Okay.
And most doctors know nothing about it.
Even the homocysteine.
I have told family members, I told a family member, I said, you've got to get your doctor to check your homocysteine because she's got bone loss and she's got memory loss. And so, again, they went to their doctor and asked the doctor, I don't know anything about that. You don't need that. Again, what they don't know about, they won't do. But let me tell you what homocysteine does.
That is scary.
Homocysteine is a toxic amino acid that inflames your body, inflames your brain. It creates plaque in your artery, but listen to what it does. It causes the plaque in your arteries, not only your arteries that go to your brain, but your coronary arteries and your peripheral arteries in your legs to calcify. When you have, it actually increases calcification in your arteries, and it also causes calcification in your heart valves. So many times for a lot of people, I want to see how their coronary blood flow is because the number 1 cause of death in this country is heart disease. So I'll run a non-invasive test, coronary artery blood flow test that checks the coronary arteries using the CT scan. So it's a coronary artery calcium score. So many times it'll come back and they can be young people in their 60s and in their mid-50s, and they have calcification in their coronary arteries.
And that's just hardening of the artery.
Yeah,
the
where it's
plaque buildup.
calcified. It's like, we call it like lead pipe arteries. So
That's where you see people losing limbs. They get their foot.
well, it
cut off
can
the
lead
leaf.
to that, but what it does, Mary, it can occur in the wall of the artery or in the lining of the artery. Now, many times it occurs in the wall of the arteries, just creates that lead pipe. And so again, they're not getting good blood flow throughout their body. And then eventually it can cause those arteries to seal off. That's why the vitamin K2, or like our super K2, prevents calcification of the arteries. And you need at least 200 micrograms a day of K2. I personally take, in each of our super K2, we have 200 micrograms. I take one twice a day because it prevents calcification. So again, that's just one thing. It causes plaque buildup in your arteries throughout your body, and it causes calcification in your arteries and your heart valves. That alone is enough to not, to get that homocysteine down.
Now, K2 comes from spinach, right?
No, it comes
No.
from natto.
No.
Natto. That's why in Japan they have a dish
Oh,
called natto. It's kind of like our oatmeal. But in Japan, a lot of people eat this fermented soybean. I don't even like soybean because it raises your estrogen level. But in Japan, it's a staple dish. And so the natto is high in K2.
oh.
And so many of the Japanese will eat this, and so they don't get the calcification in their arteries that we get here in the US. But not only does homocysteine affect your arteries, it affects your brain. It literally causes the brain to atrophy. And it causes the brain to calcify arteries in the brain, which can lead to vascular dementia. There's different forms of dementia. There's Alzheimer's dementia, there's vascular dementia, there's traumatic brain dementia. There's different kinds. But it does a double whammy on your brain because it's toxic to the brain cells, homocysteine is. So homocysteine causes a buildup of a beta amyloid in the brain. Now, beta amyloid is like scar tissue forming. So just imagine your brain shrinking, atrophying like a grape forming a raisin. So again, it's just shrinking like that. And also this scar tissue is developing in your brain called beta amyloid. High homocysteine encourages beta amyloid accumulation in your brain. They just recently came out with a new blood test that can check for beta amyloid, and those people generally have Alzheimer's disease.
They couldn't test for beta amyloid before?
No, this was just in the last month.
Wow.
It's a brand new blood test, so we're going to be able to do this test in our offices in the near future, because used to we'd have to do a PET CT scan or a beta amyloid CT of the brain to see if they have, Alzheimer's. But now we can do a blood test for beta amyloid.
Test for beta amyloid.
And this is
And
what
it shows up. That's
but
exciting.
they're missing a huge piece of the puzzle. That high homocysteine
Before
encourages.
you give that huge piece of the puzzle, we want to make sure that you comment, like, and subscribe to our YouTube channel, or join our Facebook group at facebook.com/ketozone. Okay, Dad, go ahead and tell us what it is.
Well, again, it's the beta amyloid. It causes literally degeneration of the brain, and that's the key thing, and loss of memory and atrophy of the brain. So you're literally gumming up your brain with beta amyloid and destroying your memory when you choose to have a high homocysteine level. The key is you need to get your homocysteine level down 10 or below micromolars per liter. Now, if a person has the Alzheimer's gene, which I check on many of my patients, especially with any memory loss, I check the ApoE gene test to see if they have the ApoE4/4 or the ApoE3/E4 gene. If you have the bad Alzheimer's gene, the E4/E4, you definitely need to get that homocysteine level down and even lower, to as low as 7 or lower. But if you have the E3/E4, you also should get it down below 10. Because again, those people are kind of prone to Alzheimer's disease. The other thing that homocysteine does, we've already talked about it causing plaque in the arteries, calcified arteries, brain degeneration, beta amyloid accumulation. The last thing it does, it causes bone degeneration.
Bone degeneration.
Yes, osteopenia or osteoporosis. The higher it is, the greater the bone loss. And so a lot of my female
I
patients,
was going to say, it's usually prevalent.
I check homocysteines on them, and if I see that high homocysteine level, I make sure I get them, even when they're young, I get their DEXA scan. And a lot of these are losing bone rapidly. So we got to get that homocysteine level down to 10 and then put them on a bone maintenance program, an exercise program with leg presses, and to help. See, the main 3 areas people lose bone are in their spine and in their hips, especially the femoral neck of the hip.
For men and women?
Yeah, but mainly for women. Women do it because
The hip replacement,
after 50, when those hormone levels drop, osteopenia, osteoporosis come in. So, and then the last place is the forearm. So we want to make sure we put them on
Forearm.
calcium. Yes, those are the 3 main areas where women lose bone. Men lose bone, but later, because testosterone protects the bone. If men have low testosterone levels, less than 250, they are real prone for bone loss too.
So do you put women over 50 and 60 on testosterone?
Absolutely. I mean, absolutely.
Well, I can tell.
But again, not high doses, on small doses, like a 1/10 of what a man's dose is. So I put them on a low dose, about 5 milligrams of testosterone cream, and that keeps their bones strong. I also micronized progesterone builds bone. We use calcium for the bone. We use also boron, as well as vitamin D and vitamin K2, our super K2, wonderful for the bones.
Use a little magnesium to drive it in.
Well, absolutely. Well, that's our Citracal. Citracal 1 has the magnesium, the vitamin D, and the calcium, all three. So it's a major
Our
thing.
bone
2 twice
supplement
a
is
day.
phenomenal.
Silical 1's our bone.
Yeah.
Now, is there a correlation between CRP and homocysteine? Do they correlate?
Very good. Yes. CRP and homocysteine are the dynamic duo evil of inviting disease and plaque in your arteries. Here's what happens. CRP causes accelerated plaque formation, and then the homocysteine calcifies the plaque and locks it in where you can't regress it. So you're absolutely right. So
So
that's why we got a lower
you
dose
just
of it.
said something. Once
Right.
it's calcified, they cannot.
It's less likely to be, but you can with vitamin K2 and we use high phenolic olive oils with oleocanthols, and that improves the blood flow through these arteries. And then we change the diet. We lower all these parameters, and we see even calcified plaque eventually will melt away.
I mean,
But
we've
again,
seen miracles.
we've seen
in
miracles,
Yeah.
absolutely,
Now,
of restoring
you
blood.
said the forearm because I've seen older women,
Yeah.
who
Fracture their form.
they fall and
Yeah.
catch themselves and they fracture their
It's called a
forearm.
Colles fracture.
Yeah,
And we
that
see
makes
this
sense.
all the time because that's one of the bones that really loses bone mass is in the forearm. And so women are more prone if they fall on an outstretched arm to fracture their wrists. That's why it's so important to do these exercises, like we'll do benches and overhead press to build the spine, and then leg presses to build the hip and the femoral neck. The
What
femoral
about
neck
just
and
getting in push-up position?
that's great. That'll help.
60
Absolutely.
or 70.
A plank. They can do a
Just
plank.
go in push-up position.
Exactly
and
right.
Hold it as
Hold
long as you can.
That will build their
That
forearms up.
tension
It sure
build
will.
that forearm.
But you want weight on top of that, see? You want to use weight. That's why for the hips, it's so important. I get my patients, I start them at like 50, 60 pounds on the leg press, and I say, work up to 100 pounds. The more you can load those hips, it literally causes the hip bone to get thicker and grow thicker.
When I was a personal trainer, I would have women that were, if they were over 70 and 80, just sit on chairs. Just sit,
Yeah.
stand,
Yeah,
sit,
exactly
stand.
right.
Just use
Exactly.
the
That's perfect. Exactly
That's
right.
10, 12, work them up, 3 sets.
Well, that's good.
Now, how do we lower homocysteine levels?
Tell us.
It's so easy. It's so easy. It's these simple B vitamins. But the B vitamins
B
include,
vitamins.
yes, it's folic acid, it's B12. Those are the key ones that we need.
Well, it's
And
the same ones that generally when women are pregnant, they're susceptible also to
Yeah.
getting breaks, and they take folic acid. And so folic acid's recommended for many pregnant
but we need B6, B12, and folic acid. But there's one caveat, yes, and that's in our Brain Zone Basic formula,
And our multivitamin.
and we don't have our Brain Zone Basic yet.
well,
But let me tell
a
you,
graphic up of it.
but let me tell you what, 40% of Americans have a mutation in the MTHFR gene. So even if you give them the inactive form of these vitamins, they can't produce it, or they can't produce enough of the active form. So we need to, 40% of the population, you need to give them the active form of folic acid, which is 5-MTHF. And you want to give them the methylcobalamin in the active form of the B6, which we have in our Brain Zone Basic. And you give them, if they have a high homocysteine over 10, if it's just a little over 10, just 2 in the morning is enough. If their level's up 13, 14, or over 15, you want to give them 2 in the morning, 2 in the evening. What this has in it also is trimethylglycine. It has trimethylglycine and curcumin, because trimethylglycine will also lower homocysteine, and the curcumin pulls out the beta amyloid that is created from the high homocysteine.
I know you have
So
been
it's a
on
great-
EMG lately. You have read some stuff
Love
on
it.
EMG.
I love it.
So if you have a multivitamin or taken a supplement with B vitamins, you go on the back, look. If you see on B6 where it says pyridoxine to HCl, that's the inactive form. Chances are you're not converting it to that, pyridoxal 5-phosphate.
Right, you got to have that.
Or B12,
Right.
cyanocobalamin, no good. You don't
No
want
good. You got to have the
cyanocobalamin.
5-MTHF.
Now, our multivitamin has the good stuff.
We use
That-
all the
Yeah,
active.
all the active forms in our enhanced
That's what I take every day.
and in our Brain Zone Basic. But the key is the Brain Zone Basic. But there's one thing that most every American does that will raise the homocysteine, even block the effects of Brain Zone Basic. Do you know what that is? There's one thing that Americans do every day. I'd say probably 80 to 90% of Americans do this.
Drink
And
coffee?
yes, when you drink coffee, it raises homocysteine levels.
No.
The caffeine and the chlorogenic acid in coffee raises homocysteine levels.
I thought 1 to 2 cups of coffee is good for the brain.
So you can have up to 2 cups of coffee and it will not raise the homocysteine level for the majority.
That's the
But if
key.
you go over 2 cups, now I'm not talking about 2 16-ounce cups. I'm talking about 2 8-ounce cups. If you go over that, you're going to be raising your homocysteine level. I've got people that come in and they measure their coffee consumption by the pot, not by the cup. They're on 16-ounce cups and they drink like 4 to 6 a day.
Oh, wow.
And they're black. You know what? Also, caffeine, coffee raises the blood pressure anywhere from 3 to 15 points systolic and diastolic for about 2 to 3 hours. So it's raising the blood pressure, another major number we need to know, but it raises homocysteine. But that's why those people, we got to make sure they'll cut back their coffee to 2 cups a day and take their Brain Zone Basic. They
You
need
know,
that 2 twice a day.
one thing I've noticed in the grocery store, like for example, I was just in the store yesterday and I noticed Folgers just came out with a coffee, and I thought that's the first time I've ever seen that, and it said half the caffeine.
Yeah, that's right. That's
And
good.
so they are the
Good.
word's getting out
Right.
so that you get a little bit of your caffeine that you do need, and that's why you're drinking the coffee, most likely. But that they're making it with less caffeine. In other words, it's not caffeine free.
Yeah.
It's just on the label it said half the caffeine, and I thought
Well,
that is interesting.
I always thought that was just dark roast or medium roast, light roast because
Well, this is new. I
this is
just
new.
Well,
It's like gold.
there's 2 ingredients in coffee that raises homocysteine. Number 1 is the caffeine. Number 2 is the chlorogenic acid. And the chlorogenic acid literally helps to lower your sugar, but it also will raise your homocysteine level. So just caution with coffee. As long as you're at 2 cups, you're fine. If you're over 2 cups consistently, you need to back off.
Okay. Now, chlorogenic acid, I know, became very popular 10,
Right.
15 years
Sure.
ago. Remember
Right.
the
Sure.
coffee bean
Exactly.
extract and
Exactly.
50%
It helps if you lose
that
weight in some
helps you
patients.
lose
Yeah,
weight.
exactly right.
But too much of it, you're going to jack.
Raise your homocysteine. Even though it's good for certain things, it's bad for other things. And if you have memory problems or dementia that runs in your family, you've got to use moderation, just not over 2 cups a day. You'll be fine.
Now, what is the test it's the homocysteine test. And what
It's a
is
blood
that
test.
number that they need to get to?
Well, we want to get to 10. Now, the normal numbers are 15 in the literature. Most everywhere will see 15 micromolar per liter. If it's below that, you're fine. I'm telling you, it's not. You're still forming plaque in your arteries. In fact, one study found the findings of people, and elderly people with cognitive impairment, these people who have elevated homocysteine, even if their number is 11 or greater, they still this will raise their homocysteine and cause brain atrophy in the elderly. If it's 11 or higher.
we have a patient, and we see their daughter and son all the time. And he's in his 90s, mid-90s, and he's got the Alzheimer's thing going
He's
on,
got the Alzheimer's gene, the
Yeah.
major one.
the major one.
The E4,
And so
E4.
Don worked on helping them lower his homocysteine. We just saw him, and they were like, "Our dad's doing great.
Oh, wow.
He's amazing.
Praise God.
He's on his own. We don't have to have sitters with him."
His memory's gotten better, they say.
better.
It never gets better with
Never
hell,
gets
what is that Alzheimer's?
That lowered the homocysteine.
Well, no,
How
I
did
did.
you lower it?
I lowered
Or
it
how
with
did
our
you lower it?
Brain Zone Basic. I put them
We're
on
not
the
making claims as
No.
to, you know,
I know,
we want
right.
you to consult your physician. This
Yeah.
is a nutritional product.
Right.
right. We did.
However,
I get,
This
Some
is
of
a
the
testimony of
ingredients.
what we saw, yes.
but again, I did a lot of things. I put him on the Beyond Keto diet. I lowered his sugar. I put him on an exercise program. I put him on pregnenolone, 100 milligrams a day. I have him on a full nutritional regimen. But the biggest thing that helped him was that Brain Zone Basic. He
Interesting.
was taking 2 in the morning, 2 in the evening, but it lowered that homocysteine level down around 7 or 8 is great for him. And his memory loss has improved so much, the family's amazed.
I think what's important for you guys to remember is when you go to the doctor and he comes to you and he reads the blood test and he goes, "Oh, it's normal." You need to know
What's the
what it is.
Know your numbers.
Not just normal, because you got to know your numbers. But
And most
you
doctors
gotta
have
know
never
that.
even heard of homocysteine. And I discuss a lot about this in my book, Dr. Colbert's Healthy Brain Zone.
Okay, Dad, this has been a great show. Keep your homocysteine levels below 11.
Below 10.
Below 10.
Below 10 is even better.
Okay. And olive oil, high phenolic,
phenolic,
and
yeah.
oleocanthal.
Yes.
Okay.
And Brain Zone Basic.
And Brain Zone Basic, which, great.
And don't forget your Super K2 now.
Okay. Now,
Prevents calcification.
we're not going to forget the super K2. It's super. Hey, thank you for staying with us. We've got another show. We want you to make sure that you find out what number, are we at 8?
No, that was
8.
That was number, yeah, number.
We're number,
You're right.
we're
Number 8. You're right.
Get ready because
Know
it
your
has
numbers.
to do with your liver. So stay
Your
connected.
know your filter.
Know your filter. We'll see you in the next show. Bye.